think I'm live. Good morning, everyone. Welcome to our weekly virtual forum. Lots to get through today. At the same time, we're seeing fewer questions come in, and so I wanted to make the announcement. I think we're going to move these virtual forums to every other week, still same time, same day, but the next virtual forum will be in 2 weeks from today. So there's still going to be plenty of different ways to get information. Make sure that you're enrolled in the broadcast text messages. There's lots of emails that come out from the news feed. And don't forget that we want you to be information seekers. We want you to stay engaged. Please ask all and any of your questions to your managers. If they don't have the answers that you're looking for, I think you know how to get a hold of myself. Don't hesitate to stop by or email me. So we're going to get going on the meeting today. First off, as always, thank you so much for everything you're doing for our patients, for each other. Thanks for being flexible, adaptable. Again, those are going to be critical now in the environment that we're operating in, and as we move forward, lots of uncertainty, and so flexibility and adaptability are critical. I also want to just again say thank you to all of our nurses. We had Nurses Day this week. Hopefully everybody got to see the video. I want to give Dr. Brettauer a unique shout out. Creative use of Lysol, fly swatters, and I have no idea where he came up with the coronavirus ball, but that was very creative. He won the creativity award. So hopefully that put a smile on all of our faces. And again, thank you to all of our nurses. Speaking of nurses, we have a few that are going to be on the call today. We have John Bring on the call. We have Beth Gard on the call. We also have Peg. She's going to join us. And then hopefully Dr. Bird is going to be on a little bit later. And so to the extent that questions come up that they need to answer, we'll bring them in. The key topics we want to go over today, we'll give you an update on how the state and how the community is doing with cases, hospitalizations, etc. We had a big week. We started to resume more elective cases this week. Largely, the feedback I've gotten from our surgeons, from our patients, individual anecdotal information has been extraordinary. We're going to talk through how that's gone. I think John will lead us through that conversation. We also, as an additional precautionary measure, we're putting in some testing protocols for our procedural patients before their cases. We put that in place earlier this week. Largely good reception from our patients. They understand what we're trying to do. Beth is going to talk through both the protocol progress and what our expectations are going forward. We know that there are some questions around current comp policies. Talk through that, travel policies, we'll talk through that. And then obviously, as always, to the extent that you have questions and you get those posted in the comment section, we'll address those as they come up. So let's dive in. Let's start with how we're doing as a community. First with the state. You can see what we've done from a testing, both from positive cases as well as total number of tests. 7,000 positive cases across the state, 40,000 people tested, up quite a bit in both categories. Obviously, one is dependent upon the other. Last week when we talked, we had about 27,000 tests, so up 13,000 tests in a week, and an increase from 4,281 in total positive tests. So I think some good things actually when you consider that if we've tested 13,000 more on a weekly basis, you can see that there's quite a bit of capacity. Early on, a lot of our policies were built around the idea that there was limited testing capacity. So with 13,000 more people being tested in a week, and from my understanding with the calls we've had with the governor, there's actually unused testing capacity. There's a statewide initiative. We also know that the large health systems have capacity, and we'll even talk about how we're tapping into capacity through our procedures around our procedural patients. So some good news actually in that. The unfortunate nature of this is we're up 20 deaths across the state. We were at 70 last week. On this slide, you can see that we're up to 90. As a Omaha Metro resource, still hovering around that 60% occupancy rate. Last week we're at 61. This week we're at 64. We're at 79 total inpatients diagnosed with COVID, and another 57 that are under investigation. Last week that was 52 and 62. So some fluctuations there. At one point in time, I know that was well over 80 total inpatients. I think some of what we understand is the transfer policies related to those community hospitals across the state into Omaha have been firmed up, and so I think there's actually some transfers that are coming in from outstate into the Omaha community. So maybe that's attributable to some of those number increases. Vents largely unchanged. Last week we were at 16 total patients on vents. This week we're at 21, as you can see there. So obviously the numbers are going to continue to fluctuate. Some uptick. I think the key takeaway is this is far from over, but I think we're understanding more about the restrictions that we need to do as a community to make sure that we're keeping people safe. I think we have done an extraordinary job. We're going to continue to evaluate these. I think everybody has the same goal of getting closer and closer to normal as possible, but we need to make sure we're using as much data as possible, even though at times it's really difficult to come by, in order to make the decisions on our internal policies to keep you all and our patients safe. So that's where we're at right now. I'm going to now jump in, include John. Welcome, John. And Beth. Welcome, Beth. Equal this out a little bit. Welcome them. Hello. Happy Nurse Week and Day to you both. Thanks for all you do. Beth, I loved your comments in the video of, the idea of whatever brought you to nursing. I just thought that was really special. I think that's right. We got to tap into that right now. Challenging times, and we need all of our strength. So thanks for your comments. I thought that was really special. Unique week, more elective cases, lots of ramping up. Maybe I'll kick it over to you, John, with that very unique mustache as well. Can't get over it. Looks good. Really good, I think.
Yeah.
How'd the week go? John?
Overall, really well. No major hangups. I mean, I think a couple things here and there. We still have some tweaks to do, but overall, maintain good safety precautions throughout, without any major delays. With some new concepts in our block scheduling, we were very efficient as well, and we were able to hit about an average of 30 cases per day throughout the week, which was pretty much spot on for our goal. In our ramp strategy. Again, clarified a little bit of stuff around precautions that we needed to use. Got used to wearing some of the PPE a little bit more as we had more cases. But overall, really, really good week to launch with.
Yeah, Beth, I mean, you're working on getting people into those cases, spending a lot of time communicating back and forth with obviously the surgeon, their teams, and the patients. Any feedback from especially the patients as we've rescheduled and processed those cases and trying to work through that queue?
Yeah, I would just give a huge shout out to the clinic nurses as they're having those direct conversations with the patients and really keeping them calm and talking through that process with them. It has been very smooth in getting them scheduled. And honestly, it's felt like Christmas Day when we call patients and give them a date and time, because something they've been waiting for, something they've been hurting, and being able to do those patients safely has been very special. And we're excited to be able to offer it again.
Great. So as I mentioned at the top, we're going to put in a testing protocol for all of our procedural cases. Beth, you want to talk through our processes, how we're going to do that, who's doing that, what our expectations are, timelines, all of the key bullet points on testing for patients?
Yeah, so kind of in follow-up to the news email that went out yesterday, we started to call patients. We got a hold of about 200 patients to start to get them scheduled for that preoperative testing. I know Peg talked a little bit about it last week, but it's that PCR RNA testing, which monitors the active disease. And for the majority of the patients, that's that nasal pharyngeal swab, right? So it goes into both nares, takes about 15 seconds to swab both sides. We were able to work and create a specific partner here in Omaha, Urgent Care of Omaha, their Rockbrook location, which everybody knows because it's right next to Don and Millie's right there on 108th and Center. Seems to be an Omaha landmark, which is funny. Our patients just pull up directly to very reserved OrthoNebraska parking spots with our signage on it. Their team comes out, does that swab that just takes a couple of minutes to do, and the patient is on their way. We're doing that testing 4 days prior to surgery. And the reason for that is we want it as close to surgery as we can so that it is the most accurate that it can be, is the reasoning kind of behind that 4-day. And then the patient, when they return home, remain in self-quarantine until surgery. So they're at their homes in their normal environment. We're asking them not to leave their homes, trying to get them to be able to work from home, do their normal day-to-day in the home environment versus being out and about, encouraging frequent hand washing and social distancing to whatever extent we can do to make that happen. We get those results anywhere from 48 to 72 hours out. So we should be having those consistently the day before surgery. Obviously, if anybody came back COVID positive, we would cancel them and reschedule them at a later date when it was appropriate. And we would figure out that appropriate date really with working with their health department as well as PEG and discussing the specifics around that. Anybody who is negative or positive will be notified of what their results are and will be notified as well. So we can get that in their chart and have that prior to surgery. So far, the reaction from patients has been very positive. So again, we got a hold of about 200 patients yesterday. About 130 of those will go to our preferred vendor, and another group of those will go to their primary care, or they may be out of state or out of the city. And so we're setting up special testing for them a little bit closer to home. So yeah, it's exciting stuff. It's another layer of protection for both our patient and for us working it, which is where we wanted to be.
Great. Peg, John, anything to add there?
Just thank you to everybody for their hard work in getting this set up in a very short amount of time, and getting those phone calls done too. I mean, that's an amazing amount of phone calls that got done pretty much in one day. And so thank you to everybody's teams for getting that set up for us and getting things going.
Yes, and it must have gone well because I did not get one single phone call about it yesterday. So good job, Beth.
Peg, one of the questions that came in, and Beth, you might have addressed this, but what type of test are they getting, and why is that the test that we're doing, and any insight into actual antibody testing?
I'll start. We are doing, as I noted last week, we're doing the PCR for the RNA of the actual virus itself. So we're measuring the active disease where the virus is circulating into the tissues of the throat or the back of the nose. And so that is indicative of an active disease. And that's what we want right before they go into surgery. Now, the antibody tests are still questionable. They're getting closer. The activity I've seen is more with the IgM test, which is the longer antibody production. And they're hoping that within the next couple weeks, we'll be able to have a process in place. We may not have enough test kits yet, but they're getting very close to being comfortable with one that would give us an indicator of past disease. As you remember from last week, IgM is your long-term antibody production, and so that would just indicate whether or not you've had it in the past. Now, the next question typically is, then how long am I immune? How long does that antibody stay in my blood? We don't know yet. We don't know. The guesstimate is that sooner or later you would lose immunity. You would lose it, but we don't know how long. So right now you have to assume, even if you've had the disease, that you can get it again. More to come.
Great. So we have many layers. We've always thought about this in layers of safety precautions. We have obviously our call ahead, screening related questions and request to wear a mask on campus. And when they get to campus, we have our exterior barrier screening. We have our virtual waiting room. We have our PPE. One of the questions that came in advance was many providers and staff come into work without a mask because the mask temperature checks at the stairwell entrances are now gone. Is this something we need to reevaluate? There has also been some construction workers without booties on because of the same issue. John, I know we talked about this a little bit. Any insight into how we're getting masks to our employees and consideration of where masks are required to be put on as they come onto campus?
Yeah, so we talked through this quite a bit, and really for the short period that we're walking into the building or even out, using good social distancing to get to those more internal points, maybe more in the departments to do those temperature checks and get a mask on. Following those guidelines, we're still maintaining good risk control at that point. If you are seeing people who don't have the right booties on or things like that, definitely ask them to put those on or direct them to the right place to get their PPE. I don't think anybody's gonna balk that you're requesting them to put on the right things, and we need to do the right thing to make sure everybody is on the same page. So help your peers with that. And then if you do have questions about where to obtain PPE, again, make sure you seek those answers out. And if you have other suggestions for us, let us know. This is not set in stone, and we can always continue to evolve and make this process better.
Yeah, I like that point, John. As if nothing else, we're trying our best. We're trying to get this right. It's going to be really difficult to know if we got it right. The data is never going to be clear. But one thing we've tried to do is learn very quickly. And so if there are things that are not working, if you all are observing things that should be working differently, raise your hand, reach out to your manager, reach out to obviously Dr. Brueggemann, myself. We'll evaluate it and we can adjust. So Mindy had a question here as well, John. Even though a patient is tested negative, the testing that we're putting in place, safety precautions related to intubation, extubation, spacing in the ORs, any changes there?
Not right now. We're still continuing to evaluate that and making sure that we have our testing process down very solid and understanding just how all those pieces work, both for our patients in town and out of town. Down the road, we will definitely evaluate that, but for now, we're sticking to our same precautions.
Great. Peg, anything to add on that?
No, I think that it's good that we maintain all of our precautions as much as we can until we are confident that the patient is truly negative on the day of the procedure, and that probably won't happen until we have a vaccine. So we need to stay safe all the time and assume everybody has it.
No. Okay, one of the other questions, Beth, while I have you here, is around whether or not we're going to continue to use the virtual check-in, the virtual waiting room. We're going to continue that. Is that something that we see being around for a while yet? You want to comment?
Absolutely. So we found it to be a great patient experience thing alongside the safety component of it. At this point, absolutely, we're planning to continue it. We figured out some different processes to be able to scale it as our numbers rise in the clinic setting. So to make sure we can still be efficient and effective with it. Some of those changes have rolled out and some will roll out early next week, but a great team that's working on it and making a difference for that patient. So absolutely.
Yeah. As we discussed last week, even though we're ramping up procedures, it doesn't mean that we're going to stop with all of our precautions. It also doesn't mean that we're not going to evaluate it as we go. So I appreciate the questions and asking how long these policies are going to continue on. Still in the safety realm, but more personal is, we get a lot of questions around travel policy. We have Memorial Day coming up. We wanted to address that. Here's what we have decided at this moment. We are going to relax the restriction on personal vehicle travel. So we had put that in place. We were trying to avoid hotspot locations, make sure that we're not spreading it amongst different domestic locations. I think what we've learned is that no community is going to cut themselves off from the spread of this virus. Again, our entire philosophy from the beginning was try to slow the spread. I think we've done that based off of our early policies, but we're going to relax the personal vehicle travel policy. So if you want to drive down to Kansas City, if you want to drive up to South Dakota, that is now acceptable according to our policy. We would still have the same requirements around large group gatherings. Please do not do that. I think that's been a key source of spread when they do when they actually do the contact tracing. More and more articles even that came out this week around the spread around the United States. A lot of it originated based off of domestic travel to large airports and travel international hubs. So reduce the size. Personal vehicle travel is acceptable. Continuing on with all of these other safety precautions, the barriers, the temperature checks, masks in all of our different clinical areas, still trying to limit the sizes of people that are congregating in break rooms. All of that is still important as we relax these restrictions. The other big question remains, what are we doing around mass transit? And to be very frank, we're going to hold on that decision right now. As early as this morning, we were still discussing that as a leadership group and with our board members. We want to make a decision. We know that that's important. Clarity. We know that clarity on that decision is very important to you. But we're not going to make a commitment one way or the other today. I would anticipate over the next week, we will make a decision and we'll get that information out to you. I would also remind all of you that as healthcare professionals, whether you're a nurse, tech, administrator, you're working in a billing office, your peers, your family members, your friends are looking to you to set an example. And I would just make sure that you're thinking through the example that you are setting in any way you interact in the community as you make your travel decisions. People are looking to you to see what is acceptable and what's not. Whether you like it or not, you're in a leadership position in this pandemic. And so just make sure that you're considering that when you're making your travel or gathering related decisions. So that's going to be the change, loosening up the travel restrictions. Still more to come on mass transit. We understand that travel is important. We want to make sure that we can get closer and closer to normal. That's the step we're going to take this week. Peg, Beth, John, anything to add? Anything I missed on that?
Oh, I would just like to note that we listen to the every morning at 9 o'clock. The state has a United Command conference call, and Audie Poor, who is head of our health department here in Douglas County, notes every single day what % of people were involved in large gatherings, and it's always around 30 to 50% of the new cases are associated with gatherings of people where someone in the group was active and then ended up spreading it. So even when you're not at work, as Levi said, it's so important to think about social distancing, where you're at, who's around you, and protect yourself, because you never know who's positive.
Great. Beth, John, anything else to add on that topic?
I think just be smart, make good decisions. A lot of this is common sense. So like Levi said, be a leader, because people are definitely looking to us.
For clarity, one of the questions that came in ahead of time was, do we need to self-quarantine for 7 days upon returning? So for clarity, personal vehicle travel, no quarantine. Everything still exists though, as relates to wearing masks and self-monitoring, temperatures, cough, all of those different symptoms, make sure that you're monitoring, doing self-monitoring after travel, and making sure you're notifying your manager and staying home to the extent that you develop symptoms. So I think we can move now. There's another question that came in advance, and it's related to comp in both operational considerations as well as what's the policy. The question that came in is, we're going to operate on Saturdays here. Is that going to will those that are working on the weekends receive the differential pay? The answer is yes. All of our pay policies will be in place. We also, though, have the modified compensation policy, which we have the reduction for the fixed FTEs, and if you're in a volume dependent department and you don't have sufficient hours, it was the opt into the labor pool, PTO, and then gap pay up to the 95%. We're seeing departments that are volume dependent needing more and more resources. So in pre and post, in the OR, to some degree, even in inpatient unit, we're seeing volumes obviously rebound, and more people are getting closer and closer to their FTE. And so the pay policy that we have in place that we said was going to be for the last 2 pay periods is going to stay in place for the next pay period. We're going to continue to evaluate that as we go. We said we're going to learn. We're committed to that, but the pay policy is going to stay in place. But we need to make sure that we're on the same page as it relates to what that means for those volume-dependent departments. The first step in this is, if there are sufficient hours based off of volume, based off of activity, you'll work up to your scheduled FTE. After that is when the pay policy for those volume-dependent areas kicks into place. And the first step, obviously, is to the extent that we need hours for labor pool, we want to make sure that we're contributing. Everybody needs to be helping out in these safety protocols, including helping out at the barrier of the campus. Then the PTO element, and then obviously gap pay will fill in everything up to the FTE commitment that we've made, which is at 95%. Those that are in fixed areas, it's still 95% of historical comp. And for PAs, 10%, and then the management reduction is still in place. So no changes to the to the compensation policies. Yes, there will be differential pay. And then I wanted to make sure that we're clarifying how the pay policy exists. This modified pay policy exists or works for those that are in these volume dependent departments. John, Beth, a lot of operational team members report to you all. Anything that you want to add or that I need to clarify in that?
I don't think so. I think just as the volume changes, like you said, that we focus on filling those, immediate needs and resources within those departments, and then we look to labor pool and those needs and those checkpoints, and then if we're below those hours at that point, then we'll move to the PTO and the gap pay if needed.
Yep, just shout out to everybody who's been doing the labor pool. It's been really awesome to get to know people across departments, and all of you guys, thank you so much for your help. It's really made a huge difference.
Man, adaptability, flexibility, that's going to be key for a long time. I think what we've learned through this process is the environment will change around us. Our mission, our values aren't. So we just need to make sure that we're flexible in working in the environment around us. So got to tell you, we're at 9:30. There's not a lot of questions come in. We have hit on all of our key topics. So I think actually today, unless we get some questions here over the next couple minutes, I'm gonna let the group that's on the call give their last comments, and we might end early today. So I'm gonna start with you, Peg. Any last comments?
Just again, thanks everyone. Just update a little bit on we're continuing to disinfect the masks with UV, and just a reminder to people that if we can only disinfect the masks as long as they're clean coming in, meaning there's no makeup or they're dirt, because the UV can't go through that. And so we appreciate that people give up their makeup. I was excited I could put lipstick on this morning. So it's a rarity these days. So anyway, be careful with your masks and recognize that we can disinfect them about 3 to 5 times. And we're doing right around 400 a week right now. So thank you.
Thanks, Peg. Great job. Maybe John, before you give your last comments, Amy just put in a quick question related to medication shortages. Anything you want to tackle there?
Yeah, so we evaluate our medication supply daily, and we currently are sitting very good on our supplies, both from an RSI sedation standpoint. We're staying close to antibiotics, or pain meds. And so we continue to evaluate that very frequently, and also just the ordering patterns around us. We also stay connected with others in the community from other organizations to see how their supply chain is going with drugs. But in our area and our facilities specifically, we have not run into this issue yet.
Thanks, John. Last comments from you?
Just again, huge thank you to everybody for continuing to be flexible, adaptable, and we know we've had a lot of big asks of a lot of people, but everyone continues to step up to the plate, and just really proud of our team and everybody for just going above and beyond, even in a pretty high stress time. So thank you, everybody, and happy Nurses Week.
Thanks, John. Beth?
Yeah, just thank you again to everybody. Continue to stay smart and stay safe throughout this, and appreciate all that everybody is doing, and happy Nurses Week.
Thanks, Beth. Great job. All right, all. Thanks for staying engaged. Please continue to do so. Ask your questions through managers, emails. Get them in to this forum in advance. Again, we'll resume in about 2 weeks. I do want to say that in 2 weeks, I think we'll spend a little bit more time talking about obviously how we're operating and things we've learned over the first few weeks of resumption of elective cases. But we also want to start talking about moving forward into the future. We have a lot of work that still has continued on. Our mission has not changed. We have created something incredibly unique around delivering extraordinary orthopedic care. We have an obligation to deliver that across the state, and we're going to continue to pursue that. How we have developed quick competencies around telehealth gives us tons of opportunities. I think we want to talk about how we can continue to extend that across the region. The team has done some work around that. We announced quite a bit ago, maybe 2 months ago, that we're going to be developing a clinic within the Think Whole Person Health Clinic. That project is moving along. We might want to spend a little bit more time on that. As you know, and as many of you have been engaged, we have been working on our presence in further West Omaha, specifically in Elkhorn. More and more work has gone into that. Maybe in 2 weeks, we'll spend time on the progress and how that's coming along. But our opportunity and our mission has not changed. Our opportunities in the future, to me, based off of how well we've done in these really challenging times, are even greater. Our patients really depend on us. They value us, and they see how hard we work to keep them safe in these times. And our mission is just growing. So we'll talk more about the future. As always, keep looking out for one another. Thank you so much for being adaptable, flexible, committed. All of the management team, all of the surgeons, all of the board members, they couldn't be more appreciative for the work that you do. So thank you, and we'll talk to you in 2 weeks. Take care.